Good afternoon, everyone. Thank you so much for joining us on this Health for a Change webinar. My name is Rochelle Seeger. I work here at the Foundation for a Healthy Kentucky, and I'm honored to have been working at the Foundation since 2013 as a Community Health Research Officer. And here at the Foundation, I work on the Foundation's data initiative, including the Kentucky Health Issues Poll, the Foundation's data website, KentuckyHealthFacts.org, and also this series that we call Health for a Change. The Foundation for a Healthy Kentucky's mission is to address the unmet health needs of Kentuckians. And the Foundation does that by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. First, I'll spend a few minutes on the Foundation's work. The Foundation's website is healthy-ky.org, and on that website you can find some of the research reports like the Kentucky Health Issues Poll reports that I mentioned. Our mission reports about our different initiatives, upcoming events, and also the news releases. On that website you can also sign up to join the Foundation for a Healthy Kentucky's newsletter. Another one of the Foundation's initiatives is the Coalition for a Smoke-Free Tomorrow. Check out more about the Coalition for a Smoke-Free Tomorrow at smokefreetomorrow.org, and you can also sign up for that mailing list. This Health for a Change training series the Foundation began in 2011, and I'm excited to say that the Foundation has had participants from all 120 counties engage with us on this free training series. This training series was originally developed to support the work of health advocates, health departments, and people just like you working across the state of Kentucky to support efforts to make positive health change. I'd like to announce two upcoming health events. June 26th, we'll have a webinar with Valerie Horn from Whitesburg, Kentucky. And also on July 10th, we'll have another conversation with Michelle Howell, a farmer in Allen County. This Health for a Change training series is built on and relies on partners that we have across the state of Kentucky. We went to Whitesburg last summer at Komen Community Kitchen. That photo in the middle that looks like the big farmhouse is the Howells Farm in Allen County, Kentucky. And we've also partnered with Jessica Bellamy, the Root Causes Research Project, University of Kentucky Center for Smoke-Free Policy. We had a number of webinars on the U.S. Census. And we partnered with other organizations like Kentucky Colleges and the Louisville Free Public Library. The archives of the Health for Change training series, the recordings of the webinars, and the slide decks are all posted on the Foundation's website, healthy-ky.org, the Events tab, and Health for a Change. So there's an archive of all the events we've had on those topics there. Finally, I wanted to talk a little bit about the title that we have for today that includes Kentucky Inspired. More than a year ago, I thought, I really want to have conversations with people I've met in Kentucky that are doing great work on improving health. People in Kentucky that have been working for not 1 year or 5 years, but decades on working to improve the health policy, and the health of our fellow Kentuckians. So that's what I wanted to do, engage in a conversation to learn more about their work, learn more about them as a person, and so that I can learn from them. And that's why I decided to do this called Kentucky Inspired. And of course, early this year, we had the COVID-19 pandemic, and that kind of changed my ideas because everyone's schedule changed. So that's why we come back around to have these conversations that I'm calling Kentucky Inspired. So I'm thrilled to welcome to today's call someone that I've known since 2000, 2 decades, Virginia Bradford. Virginia Bradford's a nurse, and I'm thrilled to have her today on our conversation, Kentucky Inspired. We'll be talking about COVID-19, health equity, cancer. Welcome, Virginia. So glad you're here with us today. So
Hello.
you're a nurse
Thank you
by
so much for
training.
inviting me.
Yeah, thanks,
Yeah.
Jenny. I'm glad you're here to talk with me today. You're a nurse by training. Tell us how you got involved and some of your background about working in the community for improving health.
Well, one thing is I've been a nurse now for 48 years, and early in my career, as I was taking care of patients in the hospital, one of the things that we identified was that they were coming in and their complex diseases were out of control due to noncompliance of taking their medications or eating correctly or what have you. And I joined a group of nurses, KYANNA Black nurses, and we actually came together to figure out what could we do to prevent these patients from coming into the hospital in such dire straits. And one of the things we knew that we had to do was be out in the community to educate and be a resource for them, and also to help to monitor their diabetes or their high blood pressure. So that's actually how we got started earlier, just making sure that people who didn't come to the hospital until they were almost ready to die. But we wanted to make sure that we could empower them with some education, work with them and their families to improve the quality of their lives. As we were doing that with KYANNA Black nurses, one of the things I kept hearing was, well, why do you always say that African Americans are at the highest risk of diabetes and heart disease and high blood pressure and all that? What makes that happen? And that's where we get into talking more about the comorbidities of diseases and why we're at risk of having the worst rates.
Yeah, and also we have a hugely complicated healthcare system that's very, very hard to navigate. So this program sort of sounds like a community health worker or a patient navigator type program. Tell us a little bit more about the KYANNA Black nurses and what that group is doing currently and what they've done in the past.
Well, in the past, again, what we've been doing is being out in the community at health fairs, at various churches, writing grants to allow us to be able to do the things out in the community and to prevent that patient from coming into the hospital. If we can keep people out of the hospital and keep them with their blood pressure control and their diabetes, making sure that they understand their test results, making sure that they understand about how important diet and nutrition is. And then also, we know that education is power. Knowledge is power. And so just making sure that the folks at the churches or the different organizations, they can come out and get health-related information, particularly working with the American Diabetes Association, for example, early on, American Heart Association. We've done a lot of preventative education and then also looking at maintenance. So right now what KYANNA's been focusing on is, I think everybody else, is COVID-19. And so we were trying to identify some areas where we felt that right now we needed to be. And so we looked at the senior apartments and the senior high-rises because these folks are, even though they might be staying at home, but were they wearing their mask? Did they understand the importance of getting on that elevator with less people versus being on an elevator with a crowd of people? Making sure that they understood, how we could contract the coronavirus, making sure they knew about good hand washing practices. So we came together. We had a small grant from the National Black Nurses Association. And so around the country, each chapter of the National Black Nurses came up with their own ideas of what their community needed. And this was one area that we really needed to be in, and it was very successful. We weren't able to do the in-person education, but we developed a card that was easy for them to read, easy for them to understand, giving them the steps of how to protect themselves. But we also had on there a scripture to give them some inspiration, lift their spirits because of being in the house. Also looking at resources if they needed someone to bring them groceries or, just things that we take for granted, but as a senior, and I keep forgetting that I'm one of those now, but just making sure that they are able, if they're unable to leave their homes, what can we do to help them? So that's been our project this year recently as far as KYANNA is concerned.
Yeah, that's a great example, and connecting people person to person with the resources and the support they need in times of crisis or day to day. And I mean, Jenny, I know it was a few years ago now, but when my father was in the healthcare system and he was sick and I did not know what to do, we're in the hospital and I didn't have the answers.
Right.
I called on you. Like, I needed advice, so
yes.
I called the nurses in my life that I knew, and this person-to-person contact is so important. But let's look a little bit, take the picture out a little bit wider to talk about this idea that people call health disparities. Talk a little bit about
okay.
How you understand health disparities and how you see that working in our community.
All right. Well, I guess I really want to start with what the World Health, what WHO says. Health is the absence of avoidable, unfair, or remedial differences among groups of people, whether those groups are defined socially, economically, demographically, or by the means of stratification. So what do I mean? Health disparities means that this is affecting a population more so than any others. So when we talk about African Americans' health, we know that they have a higher rate of diabetes, heart disease, cancer, what have you. And a lot of it went back to where they live, where they play, where they work, where they worship, poverty. So when we're looking at all of these things, they may not have enough money to actually provide, to get the proper medication. Or if they get medications, they may not have enough to eat or the right foods to eat. Their incomes are lower, so therefore they don't have I guess what I want to call luxuries that some of us have, in that we can buy whatever we want, we can eat what we want, and not have to worry about how am I going to pay the rest of my bills. So economic stability, the neighborhood that we live in, some of the housing, there might be several family members in one house because that's just the way it is. That's part of the culture. Healthcare, not having access to healthcare. And it goes a little bit deeper than that as well, because sometimes people have a distrust for the health system, for healthcare, because of maybe the way that they were treated or spoken to. They felt like that the person wasn't listening to them, or maybe they didn't understand the instructions that they were given. So they didn't want to seem illiterate, but maybe their reading skills and their comprehension skills were not as good. So a lot of these things help to determine the quality of care, the access, and even the prevention measures that people get. So when we look at and when we talk about, I'm sorry, go ahead.
Oh, I was just going to say, those are all important points, because we're talking about, and this is what we're talking about right now in our country, with
yes.
respect to generational poverty and income inequality. And you said luxuries. I love that, because, again, it is about luxuries, but if we look a little bit deeper, it's about the history of our country. It's about the history of the policies. And, right now it's about what our cities and communities and governments funding. So that's really exciting conversation. Up on the screen right now, we also have the Healthy People 2020 diagram that's about the social determinants of health, and that shows a little bit about how all of these things that you mentioned, the housing, the neighborhoods, are all interconnected. The slide that you have up now, Jenny, is the Louisville Metro Health Equity Report. Go ahead.
Yes. And so when we're looking at that, our public health department does an excellent job in looking at our community. There's still a lot of work to be done. We've done a lot of work in the past 40 years that I've been out in the community, and we're still gathering more information, but there's still a lot more that needs to be done. So with the Louisville Metro Health Equity Report, one of the things they're looking at is where have we improved? And when we talk about equity versus equality, there is a difference. And so, when we think of equality, it means equal to. I want to be able to, everybody should have the same. Everyone should have the same opportunities and the ability to get health care. And that's just not equal right now. And then when we talk about equity, it's another thing. Health equity is when everyone has that opportunity. So they have the right, they have insurance, or they have the providers that they can go to, where some people don't go to the doctor unless it's absolutely necessary. And by that time, they're either at a late-stage diagnosis of cancer or their kidneys have failed because their blood pressures have not been managed. So those are the things that we still need to look at. And then we have to look at culturally, how are we educating these people? Is it on their level? Or are we just saying, well, do this and take that? There are a lot of people that are on medications that will say, what are you taking this medicine for? Well, I don't know. My doctor told me to. And so even with my church family, one of the things I do is a lot of health teaching within my church and making sure that they know that that medication is for their diabetes and this is how it's going to work, and that you have to take it the way that it is prescribed. Or if they're on two medications that I'm looking at saying, well, why are you on both of these? Well, I don't know. So encouraging them to have that conversation with their healthcare provider versus it being their nurse practitioner or their physician. So looking at health equity is just as important as talking about the health disparities. We know the disparity still exists, and we know that, again, there's still more complex things in clinical management, that we need to work on. Healthcare costs, Again, African Americans, again, are in that higher rate of developing these diseases, but not being cared for as equal.
Yeah, a great point, and an important point about insurance coverage. Kentucky expanded Medicaid to people, and Governor Beshear has just launched another messaging that he wants to get all African Americans covered with Medicaid if they're eligible, which is a great thing. And back when we were working together and people didn't have health insurance, we were getting women in for their mammogram screenings who didn't have health insurance. So again, all those things that you just mentioned and health insurance access are policy issues and have a history. So I also wanted to add in before we move on to the next topic, the Louisville Redlining Project. That's a related policy issue if we look historically in Louisville, how some neighborhoods were beginning in the 1930s, ranked on their quality, and I'm making air quotes by that, and then in turn, mortgages were let or not let in those communities. But I just wanted to touch on that, another policy issue and historical point that folks can learn more about at the redlining maps in Louisville.
Yes, and it's important for us to read and stay abreast of all of these things that our community is trying to do. And again, being involved, the partnerships and the networking in this community, there's an African proverb that says it takes a village to raise a child. Well, I always say that it takes a village to reduce disparities. health disparities in our community. So we all need to come together and look at the total picture, not working in a silo, but coming together, networking, asking the questions to the community, not going in and telling them what to do, but asking them, what can we do? How can we make these changes?
Yes.
And with that,
one of the
I'm
calls
sorry.
To action. Yeah, Jenny, I was just going to comment that I think that was exactly one of the call to actions that Senator Gerald Neal had on his Facebook event earlier this year in May, talking about COVID-19 and other things. So talk a little bit more about those partnerships and who you're working with.
Well, you know, again, when we're talking about partnerships within the community, I'm going to start with the faith-based community, the churches. That was where we first started with KYANNA as well as with KAAAC, Kentucky African Americans Against Cancer, because we knew that's where we could get to the most people at one time to do education and empower them to want to make better choices about their health care. So Senator Neal has a group called the African American Initiative, and Dr. Faye Jones, Dr. Tuckson, Dr. Ricky Jones, and I don't know a couple of the other ladies. However, this presentation that they just did was excellent, and it's even as a provider or a healthcare community educator, I've got to know more, and so I try to look at the different webinars. You guys at Foundation for a Healthy Kentucky do a great job, and I'm also surfing your websites just so that I'm more knowledgeable as I'm face-to-face with the people in the community, that I'm able to give them the right factual information. So this group really had some very good points in talking about health disparities, again, comorbidities, all of the words that we've already been talking about, equity versus, equality. So again, it's knowing and understanding. And some of us, even though we're providing the health care, we're providing the nursing care. We're providing as a physician or a nurse practitioner. Sometimes we lose sight of what are the other things that are surrounding that person from not having a better lifestyle, not having a healthier lifestyle. So what else? What are we missing? How are we missing it? And so they had some very good points of, what's been happening. So I encourage everyone to really listen to this webinar. And it was great. It was well presented, and it had a lot of great information.
Yeah, thanks. And that exact point, I'm going to go back and call out our upcoming webinars that we're doing in this series is talking about food insecurity. So right now, you and I live in Louisville, and you've worked in the Louisville area almost your whole career. So we know there are parts of the Louisville community that don't have access to healthy foods, and that's absolutely impacting their health and their health outcomes, and seniors and young people and moms and kids alike. So, it's not just about health care, but it's also about our surrounding communities and policies and budgets that are in place to support that.
Right.
And
again.
Go.
Go ahead.
You can comment on food insecurity, but I did want to move on to talking a little bit about KAAAC too.
Yes. Oh, wow. Okay, so 30 years ago, during the time that I've been a nurse and a community educator, working with various other groups. One was working with the Kentucky African Americans Against Cancer. And we started this coalition of volunteers, and it was nurses and physicians, community leaders, church pastors, members, to come together and look at why so many African American women were being diagnosed with late-stage diagnosis of breast cancer in West Louisville. And so with that, one of the things that we came together, we knew that we had to do something to improve those statistics. So we came together, up with the name Kentucky African Americans Against Cancer. Our goal was to make sure that we were educating and empowering our community, but it was social workers, nurses, physicians, community members, as well as part of, they are called council people now, but they were aldermen at the time. And so when we came together, we were able to develop a program to go out and to provide information on prevention and early detection of cancer. We also wanted to be a resource. KAAC is under the umbrella of the James Graham Brown Cancer Center, University of Louisville, and Kentucky Cancer Program. And so it was just befitting for us to be in the African American community. We were also a part of a national group called the National Black Leadership Initiative on Cancer, and I believe it came out of the NCI. And so around the country, there were coalitions such as KAAC that were working to reduce health disparities and to mobilize groups in the neighborhood. And we've been doing that, and our programs have been really good as far as making sure that people have a full understanding of where to go to get screened, programs that we can tap them into when they don't have insurance. There's just presentations that we do at churches and schools and other organizations. We're out there in the community. We also have programs where we're actually training the health ministry in the churches how to, work with their own congregations, helping them to understand why it's important for us to look at the lifestyle behaviors and improve the quality of our health. So it's just so many things that between KYANNA and KAAC, as well as the American Diabetes Association and all the other ones, that we are involved in to do that community education and to give people the knowledge and empower them. And with that being said, then we look at a better outcome. We can't say, of course, who's going to get cancer, but we can say this is what we can do. We can find it early. We can treat it. We can get you navigated to treatment, and then you can live. And we've got plenty of examples of that as well when we get ready to talk about the support group and the survivors. But again, the Kentucky Women's Cancer Screening Program is a national program out of CDC as well that provides access to screening for women who are uninsured for breast and cervical cancer. If they are diagnosed through that program, and they need further diagnosis, further screenings done or treatment, there are dollars to pay for that. But a lot of people don't know the resources that are available in the community. So that's one of our focuses, as well as making sure we develop and pull together the Pathfinder. And I apologize that I don't have a copy of that to be on the website here. But if someone was to go to our website, KCP and KAAC, and look at diverse populations, they can find the things that we need and the things that we're doing that will help.
Yeah, that's a great point, Jenny, and I will share that link to the Pathfinder, that resource directory, following up with our participants today. Let's go through some of the different events and the pictures that we brought together in our slide deck today. So how about tell us about the history and the origin and what happens with the Culinary Institute.
Well, the Harriet B. Porter Culinary Institute started because the Porters, Mrs. Porter was a two-time cancer survivor who was also an educator in our community. And one of the things that she wanted to do, and one of the things that she did, is that she was out in the community with her prosthesis and her bras in her trunk, and she was educating women about breast cancer and the importance of getting screened. As we came together and started the Harriet B. Porter Cancer Education and Research Endowment, her motto was, is that life through knowledge. Again, the importance of educating people on their level. I can't stress that enough, you know, because when people go to the doctor or the nurse and they don't understand what they're saying, but they don't want to seem stupid or illiterate, they want to ask questions. So one of the things that we tell people is you have to write down your questions, ask and discuss with your healthcare team. So Ms. Porter was doing this on her own. And when she passed, her family wanted to continue her legacy. So they donated money to the Brown Cancer Center just in order for us to be able to continue our programs out in that community. Again, we had a pastor's luncheon to get the churches to buy into it. We actually started partnering with Sullivan University, and that's Chef Ekman and Chef from, Darnell. And we have done different programs with teaching people how to prepare the foods that we love, culturally foods that we love, but healthier, taking out fat and some of the salt and making sure that we're using more fresh herbs and spices and things. So the Culinary Institute has been wonderful. We bring the people from the churches that work in the kitchen, what we call the kitchen ministry, or the culinary team from the churches. Because, again, culturally, we know that food is a social offering for gathering at the church. And so we celebrate each other. We celebrate anniversaries. We celebrate the church anniversary, for example, and the pastor's anniversary. And we have a big meal. But we're giving them some options of still maintaining some of the foods and some of the dishes, but tweaking them so that they're healthier for our bodies. We actually had a kids camp that was exciting. We started that out at we started a kids camp out at Sullivan as well. But one year we decided to take it out to the community, and we went to 4 different locations, 4 different churches. And the one church that I smile every time I think about is Community Baptist Church in Newburgh area. And Miss D was the coordinator. She had 90 children signed up for that week. And we were like, okay, that's enough. But it turned out really well. We also incorporated how important physical activity was for the kids. So the kids were able to help prepare the meal, and then, of course, they were able to eat it, and we sent them home with a notebook and copies of the recipes so that they could tell their moms or their dads, how to prepare the foods that they learned about. So it's been a wonderful program that we have implemented there because of the Harriet Porter Endowment.
Wow, 90 kids, that sounds like quite an adventure. I didn't bring any photos. I didn't put any photos in the slide deck of the 90 kids, but that sounds like a wild time.
I know it.
I do have a photo of the Women
was.
of Courage Cancer Survivors event, Jenny. Tell us a little bit more about the Women of Courage Cancer Survivors. It's a beautiful photo of all of you.
Well, these ladies are phenomenal. And the men. We have men as well. I facilitate a support group for cancer survivors. They're men and women of all ages. And I can tell you that this is a phenomenal group of people. Some of you probably heard Dr. John Huggins, who is one of our volunteers that started with KAAAC almost 30 years ago. And he is a colorectal cancer survivor. So one of the things about our survivors is that they want to give back. They are living life, and they're living it, and one of the scriptures says, living life abundantly. They look beautiful. So we celebrated them, and we call them women of courage because that's what they are. They're actually able to tell their stories to other women, as we're sitting and doing exhibits at different organizations, at different churches for their health fairs. They're actually sitting there to help educate. So they've been trained as lay health workers to be able to provide information on the level that the community woman that they're speaking to or the man that they're speaking to can understand the importance of early detection and prevention. And so this was a celebration that we had at the Kentucky African Heritage Center, and it was a fashion show. But it's those type of activities. You know, just a couple of weeks ago, we celebrated National Survivors Day, and I didn't include any pictures on that, but they were at Cardinal Stadium, and we practiced social distance. Everyone was in their cars, but they were able to decorate their cars, honk their horns, and parade around Papa John's Stadium. Cardinal Stadium. And it was so much fun. But it was another thing to uplift and encourage them to continue the fight that their journey that they're going on. And so this just, we did a Dress in Blue Day, which is colon cancer awareness. We did that at the new YMCA at 18th and Broadway. And, KAAAC is partnering with Gilda's Club, and we're going to have a satellite office there being in the community. So, this is a great picture from our 30th anniversary that we did in September. And we had a partner, the National Multiple Myeloma Foundation, Pat and Ed Sanders. They work around the country with different organizations, and they worked with us about 6 years ago on clinical trials in African Americans. And they were so impressed with Louisville. Dr. Chesney, he spoke at that one. They were so impressed with our group that they came back, and we actually found a patient to do his testimony here in Louisville with multiple myeloma, which they call the new cancer, the new kid in town. Partnerships with different organizations are so important. Dr. Edmonds this time from the Brown Cancer Center talked about multiple myeloma in African Americans, and that is the survivor that you're also seeing. And it was a wonderful event, not only to celebrate the work that KAAAC has done for 30 years, but to also still to encourage other people to know that there are things that we can do. This is our group. It's not all of them, but, we have an average of at least 32 members that come to our monthly support group meetings. Janika Sherrod, she's our new coordinator, and she's not new anymore. She's been there 2 years or 3 years now. But Janika is really, as I am passing on the baton and retiring, I'm still involved and will always be involved with community and with education. But she's at our HIM. Janika brings a lot of strong skills to KAAAC. She's an MPH graduate, and she is now also working on her doctorate. And so she's going to keep KAAAC alive and still doing the work that we've been doing in our community. So very proud of that. Another new partner that we got a couple of years ago. This was our third year working with Sista Strut, iHeartRadio, They wanted to bring, Sista Strut was a African-American breast cancer walk. So, yes, we work with Komen, we work with the American Cancer Society, and now we have a third one. So Sista Strut came to Louisville, and we did it down at Shawnee Park, which, if some people don't know, that's right there in West Louisville. And each year it has continued to grow. We had so many survivors that came and attended, as well as bringing their families to come out. Rachel, you probably remember when we used to do Families for Fathers at Cardinal Stadium, which was prostate cancer screening for the men. And that was successful for many years in getting African-American men to get screened for prostate cancer. So a lot of our programs, again, we're trying to figure out how to get to the people, get their interest. It can be fun. Learning can be fun. And so, again, these are just some more from the Sista Strut. And then the Survivors Party that we do with KCP and KAAAC, Party in Pink. We were at the Paristown, which is a new venue this year, and we had all the ladies out, and they love it. We used to do it over at Buckhead's. But we have about 500 or more survivors that come from across the state, and they are out and together, uplifting, celebrating each other, and just having fun. Oh, so this year, again, we did the parade of cars and luncheons that we do. We actually used to do retreats for cancer survivors. Pam now is going to have, because of COVID, we're now going to be able to do something virtually that would be the same speakers that we would have if we were doing in-person meetings. So, again, allowing people to, I have cancer, but cancer doesn't have me. That's their motto. And so you can see these ladies leave and having a lot of fun. And so, again, with KCP and KAAAC and the Susan G. Komen dinner, that's where we can bring all of the survivors across the state together. Just, again, to let people see that you can survive. And that's how important it is to get screened, and to get screened regularly and early detection, find that cancer, and take care of it.
Thanks, Jenny. I was wondering, you work evenings, weekends, 24/7. What things do you do for self-care and inspiration in your own life? If you'd like to share some of that with us, because I know you're busy 24/7. Phone's always ringing.
Yes. So one of the things that I'm doing is that as my group, or as we're bringing speakers in to talk with the group, one is we've been doing more mindfulness. And I'm such a busybody that, and I've been listening, U of L has had some great sessions also virtually online. And it's been interesting, in Gilda's Club, and then my grandson is also a mindfulness trainer. And so I've been actually working on practicing meditation. I've been trying to get more active. I was going to the gym. Well, of course, COVID kind of got that down, but I've had opportunities to take walks around the parking lot at my church, for example, and put my earbuds in and listen to some music that gives me comfort. It could be gospel, it could be jazz, it could be whatever kind of music, but just taking time out for me. It's hard for me to sit still, but I'm learning to practice just allowing even 10 minutes of my mind just relaxing. And so that's the other part that we were doing with KYANNA, is that even as nurses, we now are saying nurses helping nurses. So we have groups of providers that talk about mental health, and anxiety, and especially for the nurses that are working front line, we need to take care of them. So we, between the American Nurses Association, Kentucky Nurses Association, and KYANNA, we have some programs now that are designed to help nurses. And so we recognize that what we're doing in taking care of the community, whether it be out in the community or in the facilities or in the clinics, we sometimes still need to take care of self. So we're all learning what we need to do.
Yeah, absolutely, so important, and thank you for also reminding us about mental health. Extremely important piece of healthcare and cancer survivorship, and all of those things. I remember you mentioned the prostate cancer screenings. That was something we were doing in the Louisville community in the early 2000s. And again, some of the folks I met at those screenings in the communities, one were without health insurance and didn't know where to go for health care. So just as you were mentioning, sharing those resources, and two, people needed mental health services. It's a need, and so very important to bring up in this conversation here today. Back to the idea about health equity. People just ask, well, what are the solutions? What should we do about this? So in your work and in your history, what are some of the important things that you've seen that could help change these health disparities we see in our community?
Well, one of the things, I thought about the question, what should I change? What do I see that needs to be changed? And I thought about that. It's easy for people to assume everyone has the same access to health care. But unfortunately, it's not correct. And it's a dangerous assumption. And then I had to look at the fact that there's still some fear about health care. And the truth is that health disparities is that it is preventable. We can have better health outcomes if we can change some of the systems and the structural barriers that we have. When the coronavirus hit us and COVID-19, it has shown that there's still a problem, still very much a problem with health disparities in the United States. And we're still seeing that it's affecting the African Americans disproportionately at a higher rate. As I was looking last night and reading a lot of different sites, Louisville wasn't hit with as much as some of the other cities. But when we still look at our population, our African American population, we do know that we're still being affected in higher numbers. So what can we do? Again, we've got to fight harder for policy changes. We've got to network and communicate and connect with other organizations in the community. We can't do it all just one organization. We need everybody at the table. We know that racism still is alive, and it's real. And that racism could be that discrimination against housing, better housing, affordable housing, food, all of those social economical things that we talked about. We need to identify ways in which we can help people to get to the needed resources that they need and the opportunities in their neighborhood, where they work, where they play, where they worship. We need to work on those partnerships to sit at the table to fight this issue, and we need everybody at the table. I said earlier, an African proverb was that it takes the whole village to raise a child. Well, it takes the whole community to bring about change. And, everybody brings their different strengths and talents to the table. And I think that's what Senator Neal's group here, Dr. Tuckson, Dr. Faye Jones, and Dr. Ricky Jones and all, with the African American Initiative, that's what one of the things that, again, they're trying to do. So they're also reaching out to incorporate and include, for example, they want people to belong to this, to come to this organization and sit at the table. They have some skills that we don't have, but they can help us, and together we can look at the problems and we can come up with the best solution. We can learn how to, it's a focused community partnership. So one of the things that I tell KYANNA Black nurses is that we need to be sitting on community boards. We need to be more involved with community action. We need to be more involved politically to know about the policies and law changes. And National Black Nurses also strengthened us in that area. We are now an affiliate chapter of the Kentucky Nurses Association because, again, as providers, we need all the information that we can get, but we also need to be involved with the other groups that can help us reach those goals. So increasing diversity, increasing our cultural humility, and reduce our implicit biases in the healthcare workforce. Engage our community, engage the community that we serve as a partner in assisting and addressing healthcare equity and equality. So what do we need to do? We need to continue to pay attention. We need to educate ourselves so that we can educate others. We need to involve all groups, all types. Everybody needs to be at the table. And we need to look at our population and our community needs, and we need to listen to what they have to say. With that being said, we still got some work to do.
Exactly, Jenny. Thank you. Those are great ideas and exactly right. I mean, this is, I think listening, I'm a white person with immense privilege and a job and health insurance. You know, I need to be listening and I need to be supporting these changes, especially in the current, demands for ending police brutality and changing budgets. And
yes.
I think a great thing you said are, what are the assumptions? So exactly right.
Right.
I can think that, I read this article, journal article, but I need to sit and listen and think about what my assumptions are, and really think about those before I just, go out in community and think I have solutions, because obviously I don't. And importantly, just as you mentioned, the systems and the partnerships is understanding the historical context of what we're dealing with, So we can do a diabetes
right.
prevention program, which is great, but, if we're continuing divesting of, healthy food access as a business decision in our areas, then that has real outcomes for people. So it's not just, a diabetes prevention program.
And let me share this. Right. Let me share this when
Go
we
ahead.
talk about diabetes. So when we talk about diabetes and controlling it, the medications, if a person doesn't have health insurance, the drug of choice, which is more cost effective, may not be as effective on that person in getting their A1Cs down. And so they can't afford the medications. So we've got to look at, pharmaceutical costs. The same with cancer patients. I'm a cancer patient and I'm told that one pill or one treatment is going to cost me thousands of dollars, and I don't have insurance. I can't pay my own rent right now. These are the things that we've got to look at, that equity. I need to be able to have the opportunity to be as healthy as possible. I need assistance in the things that I need. And those are the things that we really got to work on.
Yes, exactly, and the associated policies, right. Final question. Anything else you want to share with us this afternoon as your final message to our group here today?
Yes. First of all, again, I appreciate the opportunity just to be open and honest and talking about, because it's necessary for the conversations to be out there so that everyone is thinking on these topics and thinking on the solutions. And we can come up with some solutions, but together. I love my governor and the fact that he keeps saying, we're going to get through this and we're going to get through it together. We're going to get through this and we're going to get through it together, but we're having some growing pains right now because it's being brought back out to COVID-19 has brought all of these things back to the surface. And so it's time for a change. We have to include everyone, and we have to just make sure that we're trying to do the best thing so that people have the best care and the best health outcomes of whatever they're dealing with. And that's it.
Virginia Bradford, everyone, I've had the opportunity to know her for 20 years. Thank you, Jenny, for the conversation here today. It's been a great honor to have you on the webinar, and I think the title was correct, Kentucky Inspired. You inspire me in the work and the survivors that are working together to make change in our community. I thank you so much for being with us here today. It's been a great honor. For the people who are listening on the line on our webinar, thank you for joining us today. Lots of ideas here that we need to implement in our communities to continue to work towards eliminating health disparities and working on some of these policy issues. Again, my name is Rochelle Seeger, honored to work here at the Foundation for Healthy Kentucky. This afternoon, I'll send you an email with a survey link. If you would take a few minutes, give your feedback on today's webinar, and also this is in service to the work that everyone across Kentucky is doing to improve health in our state. So if you have ideas for future topics, have ideas for future speakers, I welcome them. I hope to see you on our upcoming schedule of events. Those are all on the Foundation's website, healthy-ky.org. And we have a June webinar and July webinar that will be talking more about food and food access in Kentucky with Kentucky leaders. Finally, thank you again for joining us today. The slide deck will be available in about a day or so, as long as the recording, if you'd like to share that with your colleagues. Thank you for joining us today. I hope you have a great afternoon.
Thank you.